chronic diseases, when you put figures up like this, they all actually tell you the same story. They tell you there's a large number of patients, they're going to live for a long time, and they normally have comorbidities of some sort. So professionally, they're a patient group that needs a lot of medications. And medications are the cheapest way to treat patients. And although people don't like medications, don't like taking medications, you'll see that the patterns that you get in diabetes, over 1 million people. These are people that are coming to us. And that market's going to grow because they're getting earlier diagnosis and living longer. And most of them will have cardiovascular disease associated with them, and it's costing governments and patients a lot of money. So from a professional perspective, there are a group of people that need a lot of support. Equally, these people, until they deregulate pharmacy, if they ever do, have to come to your businesses. Just as an interesting, how many diabetic patients do you have in your businesses? Throw me some numbers. Do you know? 200. Some more? Well, it's a number you should know if you're an owner. These are people, that are frequent flyers. And if I don't know my customers, how the hell can I expand my business? So it's not unusual to ask a group of people how many cardiovascular patients, how many diabetics. They don't. But it's a massive market. So one of the things you could do is go back to your pharmacies on Monday and have a look how big that group is. Because they're really good for your business. We are going to see a whole lot of preventive care in this to prevent diabetes. We're also going to see new treatments. We're also going to see governments trying to shift costs. But look, at the moment, the productivity loss just in work is 4.1 billion. Countries can't support that sort of stuff. Particularly if a lot of these diabetic patients have also got obese. And if you do a market analysis now, you've got diabetic patients who are going to get medications from you. We were having a chat before, trying to find out the value of this. And Jill estimated that it was about $3,000 per patient per year. And my view to that is what are we doing with those 3,000 patients? If I said to you, I've got $3,000, I'm going to become your customer, you're going to look after me a bit better, wouldn't you? So the message is very clear. It's massive market opportunity. To me, whether it's patient care issues or whether it's professional practice or whether it's business development, these patients are a really good group for you to work with. You've got all the tools to do that. And, if they're worth $3,000 per patient per year roughly, well, that's a rough estimate, and if you can get better health outcomes on that, what we'll have is a whole lot of people wishing to pay to community pharmacy to do those services.